Summer's landed with a splash on the River Thames in Berkshire. But the Health Secretary can enjoy no such freedom. Just before the last of the lockdown laws are lifted in England, Sajid Javid self-isolating with COVID.
Hi everyone, I just wanted to update you all that I've tested positive for COVID. I was feeling a bit groggy last night, so I took a lateral flow test this morning and it's come out positive. So I'm now self-isolating at home with my family until I get the results of a PCR test. I'm grateful that I've had 2 jabs of the vaccine, and so far my symptoms are very mild.
Let's do this.
The Health Secretary was at a care home and in the Commons this week. It's not clear which senior members of government he did or didn't meet in the last few days. Lifting restrictions while COVID is making a comeback is a voyage into the unknown. Freedom Day for England is going ahead in the midst of rising infections. And the Chief Medical Officer, Chris Whitty, said during the week we could very easily find ourselves in deep water again. 48 hours till freedom, in inverted commas. How do you feel?
I just think it's a bit of a daft idea. And to take all restrictions away, it's not that much of an inconvenience to have, like, for instance, face masks still required in certain circumstances.
Lots of medical people have said this is not a thing to do right now. So I just think the whole world is watching us, and it just seems we seem to be taking a big gamble.
Listen, we're going to have to get back to normal at some stage, so yeah, I think we're doing the right thing. We're all double jabbed back home, so happy to go for it without a doubt.
I just think that we're going to land up spiking again. I think people will be reliant on their injections. I've been double jabbed, but I'm still very cautious, and I just think it's going to. I think the situation's not going to change. I think it's going to be worse. I think post summer we're going to be back potentially with another lockdown, but I don't think it's a good idea, no.
I think maybe if we waited for another month or so, just to see how it all unravels, might be safer.
Thousands of travel plans unravelled last night with the sudden announcement there won't be a quarantine exemption for fully vaccinated travellers from France as planned. Worry over the beta variant there means everyone coming to England and Wales will have to self-isolate for up to 10 days.
I think it's a disaster. I think they should stop this whole thing. It's ridiculous now. We've got to live with the virus. We've got to learn it's a new thing. It's not going to go away.
Disappointing because I'm double vaccinated and I thought that as of Monday it would be all right and I'd be able to come back and not have to self-isolate.
You can always criticize, but when you try to think and you're a politician and you need to make a decision, I think it's what we need to live with at the moment.
The government says it won't hesitate to take rapid action at borders to stop COVID spreading. Travel experts say this decision will have massive consequences.
In fact, the government's decision does affect everybody who is driving back to the UK through France. It's not just about quarantining those coming back from France, but also anybody who might be driving back from Germany, Spain, Portugal, Austria, Switzerland. It affects millions of people who would be driving back to the UK during July and August.
Wales lifted restrictions on meeting outdoors today, but here and in Scotland and Northern Ireland they're being more cautious about letting the brakes off than in England, where temperatures and the stakes are rising.
Well, we're joined now by Professor Ravi Gupta from Essex. He's a clinical microbiologist who sits on the government's Nerve Tag Committee, which advises on the threats posed by COVID and other viruses. Professor Gupta, 1,200 scientists have written a letter to The Lancet calling plans for so-called Freedom Day on Monday a dangerous and unethical experiment. Do you agree with them?
Yes, I mean, a few weeks ago, I was sort of echoing these same sentiments when we were looking forward to this complete unlocking. So, all the way through, my worries have been about the fact that Delta variant is the most dangerous variant that we have ever seen. And its transmissibility appears quite significantly elevated compared to the Alpha variant, for example, and it has immune evasion capabilities. So it has 2 aspects which have never really been seen before together. And you can see what's happening here and in other parts of the world. So yes, I do agree with the Lancet letter calling for caution in the way we proceed.
OK, but the Health Secretary has said, if not now, when? So what would be the point for you when it would be suitable to unlock?
Well, the whole point of us doing scientific analysis and genomics for this virus is that we act on the intelligence and the data we obtain. If we are going to ignore it, then we should probably just stop sequencing and stop, understanding what's going on in the country. So I think that, given that we are investing significant amounts of money and resource into tracking coronavirus, we should be acting on it in a sensible way. And we know that the variants are going to evolve themselves. We could be generating new variants that we don't know about yet, and they could be even worse than what we have. We could be exporting those to other countries. Of course, we are seeing very steep pressure on the NHS already that's compromising care for other patients right now. So all of these things together really make no sense in terms of further unlocking.
There is always a balancing exercise, though. I mean, I'm sure you heard just there about the impact on the travel industry, various other industries very badly affected. Is there a point where you think, OK, we are going to have to balance the risk of the virus circulating? Does that point exist? Yes, I think that there will be that point, but it's going to take time to get there. I think that rushing things through is what we've done over the last year, and it's been at the expense of people's lives. And that's not really acceptable. I think that, yes, there is a balance, but if you look at this on balance, then actually the economics also favour doing this properly rather than a rushed and illogical way. Our colleagues over in Australia have demonstrated this very nicely. OK, what is the way forward then? Do you think that children need to be vaccinated in order for that to happen? I think, yes, I think unfortunately we are going to have to offer vaccination to younger individuals, because we're not going to be able to reach the levels of immunity as a population in any other way. We do know that vaccine-induced immunity is probably stronger and more longer lasting than natural immunity. And of course, long COVID is another thing that we don't understand fully yet. Yeah. And unfettered infections is not really something we want to play with. Yeah. Professor Gupta, how bad do you think it's going to get? And do you see a situation where we will end up in lockdown again very soon? Well, that's something that we have control over. That's the whole point of doing this properly, and that we could get control of the situation, push levels of infection down, expand vaccines into different age groups, and avoid a lockdown. But the way we're going at the moment, there will probably be pressure for a lockdown if we continue, and that will be a very difficult position for the government.